September is Menopause Awareness Month, as you know. And while most women associate hot flashes and mood swings with menopause, there are other symptoms that postmenopausal women may be and often are reluctant to talk about with their doctors. I'm delighted that today I'm going to be talking with you about the uncomfortable symptoms of menopause and how to navigate through this sensitive health topic. And of course, I'm spending time, fortunately, with you, Dr. Lisa Masterson, former host on The Doctors, and currently sharing health and lifestyle information on your website, Health in Heels with Dr. Lisa. Also, of course, you are a national expert on gynecology, obstetrics, infertility, adolescent gynecology, and family planning. So congratulations on all those accomplishments. And again, it's a pleasure to be with you today.
It's a pleasure to be with you. Thank you for having me.
Some questions. What are some of the symptoms associated with menopause?
Well, as you know, menopause is a normal and natural event, and it starts when a woman stops having her period for a year, and you would think that would be a great thing. But what happens is during menopause is the ovaries decrease functioning, and that lack of estrogen causes those symptoms that a lot of women are familiar with: hot flashes, vaginal dryness, difficulty sleeping, mood swings, fatigue, weight gain. So these are things that women, don't like, and so these things can really have a huge impact on a woman's life.
Okay, and we can sort of lump those together as postmenopausal symptoms?
Yes, and the one that I really want to point out is the vaginal dryness, because that happens to 1 in 3 women. Well, actually, 1 in 3 women will have vaginal dryness that leads to dyspareunia, or pain with intimacy. And pain with intimacy can cause a woman to stop having intimacy or stop having intercourse. So that's really important. And that pain, that whole problem with the vaginal dryness also occurs because the estrogen decreases in the vaginal tissue, and that causes inflammation and irritation. And this is what causes dyspareunia, which is a real medical condition.
Okay. How can we encourage women and their doctors to discuss pain during intimacy? And when we say intimacy, we mean during intercourse, right?
That's absolutely right. Right. And we do want to encourage women to talk. We don't want them to just accept this, because, if a woman accepts the pain, she may just stop having intercourse. And, if that's a good thing for her relationship, great. But if not, then that can be devastating. So it's really important that she talks to her doctor about this and not accept it, because there are other options. And also, it'll get worse. It can get much worse if she doesn't actually treat it, because the inflammation can lead to scar tissue and tightening and things like that, which can make more painful intercourse. So it's really important that she talk with her doctor so that she can get options, because the wonderful thing is we have things to help women with this issue.
I was going to ask you what women can do to treat the pain on intercourse.
Well, there are vaginal lubricants and moisturizers, but these are only temporizers. They don't actually treat the underlying cause, the tissue, and the lack of estrogen. So again, the reason that we want them to speak to their physician is because there is a prescription medication that is indicated for the treatment of moderate to severe pain with intercourse due to menopause. And that's why I'm so thrilled to be here today on behalf of Duchenne USA to talk about Osphena, which is the only FDA...
Okay, go back a little bit and tell me what the name of the drug is. Is it an oral drug?
It's an oral. It's a pill. It's the only FDA-approved, once daily, non-hormonal pill. It's an actual pill, and it's non-hormonal, and it's once daily, and it's FDA-approved.
And how are you spelling that?
It's Osphena.
O-S is in Sam?
Yeah, O-S like Sam, P like Paul, H like Helen, E-N-A.
Okay, Osphena.
Yes.
Okay, so and say a little bit more about how that helps.
That actually helps at the tissue level. So it's going to actually help the underlying cause and not just temporize like lubricants. It's going to actually help at the tissue to bring the elasticity back to the tissue and decrease the inflammation so that you don't have that pain. That's how it's indicated for pain with intercourse.
So it's actually helpful for increasing elasticity.
Yes.
Okay, that's good to know. And where can we learn more about this whole issue of vaginal pain?
You can go to osphena.com. That's, again, OSPHENA.com, and that'll give you more safety information.
And that's on the internet?
Yes.
So technically it's www.osphena.com.
That's correct.
Okay, well, this has been helpful information. I'm sure my Health Power audience will benefit from knowing about it, and I want to thank you for spending this time with me today so we could inform people better, inform women more fully.
Great. Thank you so much for having me, Dr. Goodwin. This was fantastic.
Okay, have a good day now.
You too. Thank you.
Okay.